Kinesio taping for shin splints. This application uses one long Y strip, 8 to 9 squares in length, with the tail split only in the last 2 squares, and 2 shorter Y strips about 3 to 4 squares each. An optional I strip about 3 squares long may be utilized. Anchor the longer Y strip right above the ankle bone using the uncut section just above the short Y fork. Start up the side of the leg, cross over and extend the tape up the inner side of the leg. Attach the Y tails on either side of the ankle bone with paper off tension. On the arch of the foot, tape from the outer side of the foot across the arch with 50% and finish with 0 tension. The smaller Y strips will go over the area of pain. Start the anchor of one strip horizontally on the inner leg. Pull tails across the long Y strip using oscillations. End with anchors on the skin. Repeat with additional Y strip.
Our next application is going to deal with the lower leg. A common injury that we see in the lower leg is shin splints. Shin splints generally will show up in our distance runners and also a lot of our athletes that do a lot of jumping sports. The first piece of tape that I will apply is going to be with a modified Y, and as you can see it's fairly long. I will first free up my tails and I will expose a little bit of the tape which I will use as an anchor. Right above the ankle bone, I will have my patient with their foot relaxed, apply the tape, and activate it. Now, because I'm going to have to make a pretty sharp turn here, I want very low tension until I get around to the other side of the shin. But I need to stretch the tissue, so I will have my patient pull their foot back and out, and I will start bringing my tape around. Very low tension so that I can get a quick turn. And once I get around to the other side, paper off tension all the way up to the area of the knee, finishing with 0 tension and activating. As you can see here, so we'll roll the foot out. You can see how we came along here in the shins. Now, to attach my 2 tails this time, what I want my patient to do is point their toe and then point it out to stretch this skin. One of these tails will go on one side of my ankle, while my other will go on the opposite side of my ankle bone. Once again, paper off tension, and I will activate. The next piece that I will put down is going to go across the arch. For this one, I will use my peel down method to start my tape. I will have my patient relax their foot, and I'll feel along the outside of their foot till I feel that little bump in the bone, and I'll put my anchor right in the middle. That bumps right under my thumb. Then I will have my patient pull their foot back, and I will apply this at a 50% tension, making sure that as I do this, I do not get any wrinkles in the skin on the bottom of the foot, because that can cause irritation. Finishing at 0% and activating the tape. The final part of our application that we're going to do, I have 2 Ys that I have cut. And for this application, at this part, I'm going to have my patient move forward because I want their leg hanging the whole time. I'm going to do all the movement this time for this application. The patient will not move their leg at all for me. Once again, I will free my tails. I will make sure that I start with the leg, start my tape completely on skin. And I'm going to use oscillations when I attach this. With that, you can see I'm using little pulls. As I'm bringing it across, you can see the tissue move. Finishing with 0% tension. Lightly rubbing so I don't collapse the oscillations that I just put in there. Once again, you can kind of see also, I'm kind of pushing that muscle, that lower leg over, providing those little oscillations, ending on skin. Now, these Ys here, I'm placing them in areas where the patient is most point tender. So if you have to put them a little lower, a little higher, you can adjust them to the needs of your patient. You also don't have to put 2 down. You can put 1 down if that is all you need. In general, I have found that putting 2 down works best. Pushing that muscle over, doing my oscillations, finishing with 0. Pushing the muscle over, doing my oscillations, and again, finishing with 0. Light activation. And this is how you do the shin splint application.